We just really want to welcome you and thank you for joining Catholic Wellness Answers. This is our fourth episode, like Samantha was saying, and we've been having a great time offering this series to our My Catholic Doctor community. Like she said, my name is Jillian Stecklein. I have my clinical doctorate in physical therapy with a special emphasis in pelvic health, orthopedic care, and chronic pain. So what we'll be covering tonight is what role do physical therapists play in the birthing journey? We're going to talk about prenatal, so preparing for pregnancy. We're going to talk about pregnancy, so what are the common symptoms related to the pelvic floor specifically? Postpartum, what does that healing process look like? And how to heal. What does care look like? And we're going to get into some good questions and practicals so that you have some tools that you can take home with. And again, this is not replacement for medical or rehabilitative care, but it's an educational session for you to be able to build up your knowledge base, to be able to gain some specific techniques that can help you in your journey, and to offer you more resources if you are in need of more care. So first of all, pelvic floor physical therapy. When I was in PT school even, I honestly did not have a good grasp of what pelvic floor physical therapy was. It was this small elective we could take, but there just wasn't a lot of information out there. There are some other countries that have been treating women's health issues, pelvic floor issues, male pelvic floor issues for a number of years. US, we're starting to get there. We're really starting to bring in more care for women in this area. So that's been great to be able to do so, especially from our beautiful Catholic perspective. So PTs do receive additional training for pelvic floor physical therapy. We are trained to diagnose and treat a variety of conditions, and we're going to go through those really specifically in just a few moments here. But one of the biggest things that I want you to take away from this presentation is, while these issues are common, so one, you're not alone. Many women will have many of the things that we're going to talk about and struggle with the same things that maybe you have had to deal with in the past. But they're still not normal to have. And if they're not normal to have, then we want them to be treatable. And luckily they are. There's a lot of techniques, educational things we can do, self-care things that you can learn how to do for home exercises, looking at your routines in order to really reduce these symptoms, if not eliminate them completely. So that's our good news. My goal as a physical therapist is to help active women continue to do what they love with less limitation. And that is just what I enjoy doing. And so again, excited to just bring you this information. From a Catholic perspective, my Catholic doctor desires to offer care that uplifts and treats the whole person. So pelvic floor physical therapy from a Catholic perspective is going to really uphold the dignity of the woman, embrace her femininity, encourage and guide you in gentle ways that are not against Catholic teaching in order to improve your symptoms and to live the life that you desire and that you're meant to. So jumping right into some anatomy, not to scare anyone away right now, but everyone has a pelvic floor, and it provides a lot of different mechanisms of support. Our internal organs, for example, are supported by the pelvic floor. Our bowel and bladder function, our sexual and reproductive functions. It also assists in circulation. It helps it act as a muscle pump between the lower extremities and the upper body and getting blood flow back to your circulatory system. Posture and breathing, the diaphragm and the pelvic floor are hugely interrelated in terms of, one, providing stability, like we mentioned here, of the trunk and extremities, but also for being able to just maintain your diaphragm, your rib cage, all of the functions of breathing. So when I describe the pelvic floor as well, I like to think of it as the sling of the core. So that acts in two ways. There can be issues directly in the pelvic floor, and there can be issues throughout the rest of the body that may present themselves with symptoms in the pelvic floor, such as less stability or strength in the core, like we see during the pre and postpartum journeys. As well, for the pelvic floor, there's multiple muscle layers. There's 3 muscle layers to the pelvic floor. And so when we're thinking about something as big as birth, or even carrying your child and, holding that carrier later, doing household duties, our pelvic floor is helping us with a lot of these things. And it tends to take the brunt of any other issues kind of going on in the body. And so when we go through the list of symptoms, you're just going to be able to kind of check in your brain like, oh, I think I felt that before, or my friend was talking about that. And so just offering you more information. So this is a long list. We're going to talk about what these words actually mean. So again, in PT school, and a lot of these words weren't even super common in terms of therapists knowing a lot about them. So as both a provider for our providers here and as well for our patient community, we just want to educate on what do these terms actually mean so that you can just be more aware of, do I deal with any of these symptoms? So common pelvic health symptoms. So incontinence is one, and this can mean bladder leakage, potentially for a variety of reasons. So stress urinary incontinence is the most common, and that's where you're going to see some level of leakage with a cough, a sneeze. I was doing a jump rope at the gym. I was trying to run and I had a leak, whether it's a small amount or a large amount. We can have an overactive bladder, sometimes seen with a high frequency of urination. Also sometimes felt as like a muscle spasm, like an uncomfortable feeling in the bladder where it's just hyperactive and kind of hypersensitive. So those are some of the common urinary symptoms. The buzzword of diastasis recti separation, typically seen with abdominal muscle weakness. So what diastasis recti separation is as a normal pregnancy goes on and baby's getting bigger, we have the two walls of our six-pack abs, and those obviously need to separate to make room for growing baby through there. And that's a completely natural process, most noted at the belly button. However, after the birth and we're healing, typically in that 6-week range, if those muscles have really not come back together quite all the way, or there's a significant separation there, which is typically noted is about 1 finger's width or more apart, 1 finger's width can still be somewhat normal there. We're going to be at risk for things like a hernia to poke through there. We're going to be at risk for other types of injuries, such as like a disc herniation because you leaned over for that baby car seat and picked up baby, and then you had herniated your disc because you don't actually have that core stability present like you did before. Also, just sometimes moms report that it just feels like it looks like I'm still pregnant. They feel like they have that 4th trimester, like lower belly that's just not tucking back in, not due to maybe not being active or, nutrition and things like that, but they just feel like there's something there that's not giving them support, and it can be hard to rotate in bed and pick up items like we talked about. So being able to relearn how to activate those muscles is really important. Prolapse symptoms. And so we can have different types of prolapses. So we can have bladder prolapse, which is actually going to push in a little bit on the front of the vaginal canal. You can have a uterine prolapse where the uterus actually starts to sink down either a little bit or a lot through the vaginal canal. We can also have some pushing forward from the GI system, and that can kind of hit you in the back wall through there in the pelvic floor. And how these symptoms typically present themselves are some level of heaviness or feelings of weakness in the pelvic floor. Women may really say, I feel like something is falling out. And possibly it is to a degree. But again, have no fear, these things can be helped. We do a number of strengthening techniques, learning how to activate those muscles properly, and a lot of people are able to get back to a really active lifestyle, even with a significant prolapse. We have care opportunities for post-C-section. So I always joke with moms, there is no other major abdominal surgery where you are sent home with a baby after. It's a huge operation, and blessing, little baby comes out and all is well, but there's still a lot to heal from there. We can have difficulties with that incision, mobility around the incision, pain around the incision. Again, those core muscles have been cut through. So we find a lot of times with those moms, their lower core is just not firing as well. And it's not that it can't, it's just oftentimes it needs to be retrained. There is care for the pelvic floor following a tear or an episiotomy and maybe the scar tissue associated with that. Typically, this pain can feel more of a burning or shearing or tearing sensation in the skin folds in the pelvic floor. It can be really difficult for moms after a major tear if they're having a lot of pain in return to activity. And so doing some desensitization techniques, making sure there's just a lot of safety and that the muscles are starting to fire properly again, and some really gentle stretching. You know, with care, a lot of those symptoms continue to get better as well. Coccygeal pain, tailbone pain. Now, typically, this could have been an injury prior to childbirth or an injury potentially at childbirth. So if you have an old injury, you may start to notice postpartum or even during pregnancy, it flare up a little bit. And that's for multiple reasons of either extra fluid, or we're going to talk about some of the ligamentous laxity during pregnancy. Tailbone pain can be very painful, very sharp sometimes. There's not great blood flow to that region at the bottom of the tailbone, and so typically it's a slower healer. But by promoting some hands-on work with to the soft tissue around there and letting go of some of those spasms that surround that, a lot of people are able to get some good quality pain relief from there too. Bowel disorders, so there's a spectrum there. On one side, we have constipation, or, you know, women are straining maybe during pregnancy, or things just feel out of place. They're just not able to have a good bowel movement, or there's pain with that. And that can be for a variety of reasons during pregnancy, but sometimes, you know, after checking in with your medical provider on some of those things, of if there's anything you can take to help you with that, you know, there's some techniques too for positioning and education about diet and hydration, and some exercises in order to help women with that as well. On the opposite side of the spectrum, there can be a lack of control over the bowels, which you can imagine why many moms want to fix this issue quickly. But it absolutely does happen. It can happen just while you're doing your everyday things, maybe while you're trying to go out for a walk with your friend. And so that would come from a lack of control over some of those muscles. So like we talked about, the pelvic floor has that sphincteric control over the bowel and bladder. So either holding or releasing. And in this case, it's not being able to hold properly or on cue, and those muscles can be retrained there. Vaginismus, pain or discomfort with vaginal penetration. So this can be seen in young athletes, like trying to use a tampon maybe for the first time, who are like major runners or ice skaters, or where they're really using their legs a lot and they don't actually have a good control of their core and their pelvic floor, and things just tend to tighten up on them. Perhaps this is a concern for early marriage, that there's just a lot of pain or discomfort in the pelvic floor, and that's been really difficult and straining on you emotionally, physically, relationally. And so this is a really common problem too, and there's a lot that can be done to help relax those muscles and make sure that the pelvic floor can function as it should. Pudendal neuralgia, pain, discomfort, or numbness in the pelvis or genitals. And with that, you definitely see that more when I had my really active patients who are like on 7-hour bike rides a day and things like that. But you could also see that maybe after an accident or some sort of fall where the nerves were also aggravated. And so in working both with your medical provider and your rehabilitation provider, we can work through being able to get those nerves functioning properly with some different techniques as well. And then, of course, moms are going to have your good old postural pains of the neck and low back. Maybe it's the first time for a new baby, or maybe you're trying to hold the toddler in a car seat and all sorts of things right now. But we can definitely have pain related to feeding, bathing, carrying, leaning over. There's a lot of new requirements of our muscles and bodies. And so regular old postural pain, and from the orthopedic perspective, is of course an issue as well. A couple other things that I just commonly see with moms is sometimes plantar fasciitis, or which is pain in the feet, like an inflammatory process that goes on. It can make it very painful to walk. You know, we'll see more swelling sometimes during pregnancy, and that can add to those symptoms a little bit too. So things like having the right orthotic or some self-care techniques to improve that, depending on what your day looks like as well. Are you standing a lot? Are you sitting more? And carpal tunnel syndrome, again, typically night positioning, carrying positionings, the swelling is a contributing factor too, is another really common issue that I see in the postpartum care time and during pregnancy. So then what are some of the things that you can do? So preparing for pregnancy stage. Well, I'd highly recommend meeting with one of the My Catholic Doctor providers and getting a really good feel on your overall health, but also cycle awareness. So having that relationship already built with a provider is just going to help you when you're in that stage of starting your family. Aerobic activity and strength training. This is going to benefit your overall health, your strength, your flexibility, your endurance, as well as managing mental and emotional, just things that pop up. And so we'll have benefits there. In advance, you can just be aware of your posture. Are you sitting at a desk? Are you have a really active job? How are we using your body? What's taking the brunt of the forces throughout your body? To be already strong is only going to help you going forward. Nutrition, the more we can nourish your mind, body, and soul in advance, and taking care of yourself and having adequate calories, adequate nutrition, adequate fats is all going to help for just your hormone balance and your overall well-being. Breathing techniques, this kind of goes along with mental health too, but just for your nervous system balance, just being able to keep stress under check and all of those sorts of things is really helpful. Consider the Hello app. I've really been enjoying this. It's a Catholic meditation app. It has bedtime stories. It has Lectio Divinas. It has all sorts of things you can listen to, homilies on there, some of my favorites. I've actually been trying these during Lent just to help fall asleep faster and to get my brain to quiet down a little bit. So there are things out there from a Catholic perspective too that could really be helpful for that. That goes along with mental health and sleep hygiene. So if you're in the preparing for pregnancy zone, this is a great time to take a look of, is anything just like weighing you down? Like, can I, see someone, counselor or psychologist, My Catholic Doctor offers a variety of services there as well. Your sleep, making sure that you have a really good sleep routine. This is kind of the time to get yourself in just an overall good state. And then from the physical therapy perspective, where my focus is, that pelvic floor and core strengthening, and making sure that, we can always have benefit of making sure that our body is functioning well. So whether you are pregnant or not, it is good for men and women just to have a strong core so that whatever it is that you are doing during the day, you're going to be supported in that. Moving on to pregnancy. So during this stage, just continuing to develop those relationships with both your birthing and your rehabilitation professionals. I really enjoy doing check-ins with moms, every so often during their pregnancy. I have a little course that I take them through. They have some postural exercises. They have some core exercises. They're practicing how to prevent diastasis separation. They're doing some breathing techniques, maybe a gratitude journal. But we're not checking in constantly unless they have a major issue going on. But if they can really get on that solid home program, they're going to feel much more prepared for when birth really does come. And they're going to feel empowered with what they've learned so far. Aerobic activity and strength training, still both very important, but it's going to look a little different during pregnancy. So commonly recommended is 30 minutes of activity a day, but you'll want to collaborate with your medical professional on this. What's different about exercise during pregnancy is while it still has all those amazing benefits and more for baby, we really just need to make sure that we're screening for red flags. We're making sure from a medical perspective with your provider that you're cleared to exercise. And if you are, fantastic, because it's going to benefit your overall health, your strength, your flexibility, your endurance, those mental, emotional benefits again, and all of that is going to help for delivery. Now, if for some reason you're not able to be as active or do as many things, there's still some great things that you can do if you're needing to be in more of a restful state in terms of breathing or some really gentle exercises. Let's say you had to be on bed rest or something like that. we'll be walking you through that postpartum journey a little bit differently and maybe a little bit more slowly, but usually there's always at least a little bit of something that we can do to help you prepare. How you just might feel different during exercise is both you and baby are always growing. So your balance, your awareness of things, your strength changes. You know, when you're doing a squat, it's a constant challenge of last week, this baby wasn't so far forward. I actually have to change up how I'm doing this specific exercise. You have increased blood volume. So we really need to make sure we're watching the overheating, the water, maybe a snack. It's gonna look different than that during that prenatal stage. And so just always consulting and keeping up with your medical provider on exercise recommendations, and maybe even finding a great, you know, pregnancy group where you're with someone who's trained instead of just regular large group exercise classes. During this time, your posture, again, is always adapting. So both sitting and standing, finding a comfortable position, making sure we're always making room for baby, making sure that we're preparing. We're gonna wanna start hunching forward and coming forward, and really need to make sure we're keeping our rib cage open, our shoulders back, really having a nice open position. That's all gonna help for pelvic floor functioning, and we're gonna get into that more in a little bit too. Nutrition, of course, is just as important, if not more, during this stage. So you're really nourishing yourself with good fats, enough calories, good quality protein. And there's great dietitian referrals for all the specifics on that. Breathing techniques. Now, not only beneficial for just getting that nervous system to calm down, but breathing techniques for during pregnancy and preparing for delivery are going to help with pain relief. They're going to help with adequate pushing. And all of that is really wonderful. I tend to see the most tears or issues with births that actually go too fast or too long. Again, birth, not a super predictable, plannable event. But if we can at least have our bodies in a good position, be really educated, have some tools that we plan to use, we can usually help that process go smoother. Mental health and sleep hygiene, still important during this stage. Mental health wise, there can be a lot of anxiety around pregnancy. You can be worried, there's a lot of things changing, you know, what are we gonna do for this or this? And so still having those outlets just to be able to relax is gonna be good for both you and baby and family. Sleep hygiene. Probably in the first trimester, no one has to tell you to get enough sleep. You're probably just passing out trying to get enough sleep, but still having some level of routine. You know, things are transitioning and changing, and it's just so important to get that adequate rest. And pelvic floor and core strengthening becomes all the more important. Again, we're prepping for delivery. So maybe we're not training for that marathon this year, but maybe we're training for birth. And so you're really getting that pelvic floor strong, your core strong. It's been so wonderful to walk moms through this process. For my moms who didn't know about pelvic health PT until they had a couple kiddos and then came in, it has been so fun to watch them heal up, feel strong, feel empowered. And now they're a little bit older, you know, they've actually had maybe multiple C-sections, or they had a history of a prolapse, and they say on their third or fourth pregnancy, like, I feel stronger than I did before. My birth went smoother than it did before. And a lot of times we'll see that when we've taken that time to prepare and really look into those things. And so that is always a great joy to see. Postpartum care, this is where we see maybe more of those symptoms that were on that initial list here. Cycle awareness, still really important. It's just a window into your health. I can't encourage you enough to really look into this. We want to continue to monitor that with your, whoever your trainer is. There are special instructions if breastfeeding typically, and so being able to look into that. Return to activity, this is huge. So there's definitely a spectrum here too. Maybe you're not as active and you need some guidance on, hey, maybe I need to be a little bit more active. It's going to help me and have more energy and take care of my family. Or you really, really want to get back to that activity, and we have to do it in a stepwise function to better serve you. So definitely can be on both sides there. But return to activity, we want to start with some gentle aerobic activity and strength training. Again, guided by your medical professional. A lot of times women have follow-ups around 6 weeks, and that's when we can start integrating a checkup with your rehabilitation professional. And we can start, graduating you back to whatever activity is that you want to get back to. To start, typically, walking to tolerance, really gentle pelvic floor activation, functional movements that we perform well. I can't stress enough rebuilding the foundation. So I typically describe this a lot to patients as, think about building a house. If we don't have the strong foundation, those walls might stand on the external for a while. Like, you can compensate to a degree some of your strength. However, at some point, it's not going to hold anymore. So I've seen some incredibly fit, active moms, and they're like, I was running at 4 weeks. I felt so good. All was well. And they were actually running really fast. Like, they were winning races. They were doing fantastic. However, when their youngest was 3, so it could even be a little while, like, there was a major back injury. And it's just like, those muscles can't compensate forever. So if we never rebuilt the core, never rebuilt the pelvic floor, made sure things were good, the body can usually only take that for so long. And if we're not as active, having some sort of guidance into a progressed activity, not to where you feel like you have to do so much or this many minutes, but just the things that really benefit your overall health. Like we talked about, you're gonna need energy for your family. You're going to need to be able to carry that baby carrier. You're going to need to be able to do all of these things and have the endurance to do so. So good reasoning to get a little bit of guidance in order to get back to a little bit more activity. I also want to caution not to aggravate any issues and regress in your progress. Sometimes we really can start to feel pretty good, but we still just really have to take that stepwise function and just think of that as a process. I really like to think about it as guiding you through like that postpartum journey, or in some articles, like the 4th trimester. You can't go from 9 months of growing a baby in your womb to, magically back to how things were before. And there might be a new normal of function and how things feel and how things are set. So what might make you pause on activity as well? So if you were doing anything and you were to see any pain or excessive pain, bleeding, excessive fatigue, lack of nutrition, you just weren't getting, that you weren't getting enough support for the activity you were doing, that would take an immediate pause on your activity. And especially if you had any of these symptoms, this would be really important to discuss with your medical provider before you tried any more activity again. Posture awareness is always still important in this stage as well. We have to consider all the new demands on your body. Again, we talked about maybe it's a carrier, maybe it's a feeding position, maybe it's your routine is just different. Maybe you're at home for a little while. Maybe you're going to have to go back to an office. We just have to consider what are the demands on your body, and we have to prepare you for them. We need to make sure that you could sit in this position, that you could stand for this period of time with good form, that we're not irritating things, and that you're gonna feel strong and healthy doing these things. This is where typically we forget to nourish ourselves. I would try to leave a jug of water out on the countertop to remind myself to fill it. Especially if you're breastfeeding, we really need to think about the hydration and the extra calories and the good fats. But in any sense, your body is still healing from a major process, and we do need compassion on ourselves and nourishment during that time to allow the body to heal. It's going to allow for those soft tissues to heal better, to have that blood flow, to have those nutrients coming in so that your body can repair. Breathing techniques for the nervous system, still very helpful for all the different things that we've talked about. Your mental health and sleep hygiene, referring out to different providers for this. I always ask patients about this because I want to know if I should be referring them out for more help. So not necessarily in the PT scope of practice, but these are all holistic aspects of you that we want to consider and make sure that we get you the right resources. There could be mild to moderate to severe postpartum depression issues going on. This is brand new territory. Maybe this is baby 1, or maybe you're just feeling tipped over the edge. new schedules. And so maybe your schedule's changed completely, or maybe you are trying to go back to an office job and it's another drop off, or your toddler now really needs this and this is going on, and there's just constant demands on you. We just really need to make sure that we're addressing all of those issues. And then this is where we come into the rebuild your foundation, and then we build on top of that. So how therapy exercises kind of work, or we want to start with the basics, like, is the pelvic floor firing? Is the deep core firing? And then from that, we start to move into different positions like all fours, standing, lunging. And then we build that back to activity. So once you've done those stepwise functions, you're going to be at way lower risk for injury when you try that jump rope again. You might not have that bladder leakage because you rebuilt your foundation to begin with. If you want to go for a run, you might not have that hip pain because you already rebuilt your core and it's actually firing really well. So by the time we get back to running, you're just feeling really good. So all sorts of things to look at there. And the most important part is that it's your goal. So in physical therapy, as a physical therapist, we care about what your goal is, and we're going to help to map you back to whatever that goal is. So how would physical therapy look? So we are super blessed to have our wonderful telehealth program with My Catholic Doctor. I've been enjoying getting to know moms from across the country. It has been such an honor to get to be a part of their story and meet their families. And so first we just want to connect. I want to find out if there's any major medical issues that we need to be aware of, and how the beautiful interaction of OB-GYN and PT works is it's kind of new to some, is, from a medical perspective, they're going to make sure that from that full-on medical perspective, everything looks good. That 6-week checkup, your birth, all of those sorts of things. Where rehabilitation comes in is that we're going to help map you back to where you were at before, so where your medical appointments end, we kind of pick up and we're able to walk you through those little stepwise functions back to where you want to get to, and then vice versa. If I see someone who comes in and they look like they have a sign of an infection, or their pain pattern does not match, or they have not had an exam from their medical provider recently, we're referring back like, hey, you need to go check in on this first, make sure that's cleared up, make sure nothing else is going on, and then pop back over, and we're able to do this beautiful back and forth to offer you the care that you need. So what else that we'll do is, like we talked about, we'll discuss your goals. I want to hear about what makes it better, what makes it worse. Like, that gives me a lot of information on to what exactly is going on for you. I'm able to watch you move, and there's a number of functional screening methods that we go through to see what part of things are going well and what's not working as well, and then being able to address that really specifically for you. And from all that information, we're able to come up with a PT diagnosis. So what's going on for you in terms of your musculoskeletal system. And then we make a treatment plan recommendation for you. I give a really thorough home program. So we go through everything that you'll do together in terms of, like, we'll talk about treatments, home mobility. You're going to have really specific exercises. You're going to have self-care techniques. We're going to discuss these other factors like diet and lifestyle habits, your exercise, your hydration, your sleep, your mental health, and make sure that you have a plan for all of those things, and go through all of those exercises together and really get you back to where you want to be. So these were some of the questions that had come in advance. And so I'm going to go through those with some good background information. And then Samantha, if you want to just keep an eye on the chat box, anyone is welcome to pop in with a question on there. And I'll have her share those in a little bit here. So what are some good stretches for sore hips when pregnant? So first of all, as always, seek professional assistance from your provider if you're adding to or modifying an exercise program. But generally, gentle stretching is very safe, and we're going to go through a few things on that. Notes on stretching. So there is a hormone called relaxin that floats through your body when you're pregnant and allows for your ligaments to relax a little bit. Really important for pushing. We're super grateful for it. However, it can also put you a little bit higher risk for a soft tissue injury. And the reason is our stability comes from three main things. So our bony structure, which would include our joints, our ligaments, and our muscle. So if ligament stability has gone down a little bit because of that relaxin hormone, that can put a little bit more strain on our muscles. Now, we might find that we can stretch a little bit further than we used to, which in general is okay, but we still do want to be cautious about how much we are stretching or overstretching. I like to have my patients do gentle stretches in more of an active sequence where we're not holding things for a super long period of time. I tend to see more strains when people hold things for a really long period of time. So if you're gently coming in and out of a stretch more often, you're going to start to notice if something didn't quite feel right. So for how much is too much, if there's any pain, we should definitely not be doing the stretch. We might need to change position, or we might just need to pause on that stretch and find out more information before we continue on with that. For a modification, we might just need to think about different positions. And like I said, that could change week by week. So, second trimester, we're not really resting on your back. We might do some stretches on your side. We might do stretches on all fours. We might do some stretches in seated. And, it's also about what you prefer. Are you trying to do a stretch during your workday? Are you wanting to make this part of your exercise routine? So both just where your body's at the time, as well as your personal preferences play into this. When should I seek care for an issue I'm experiencing? Well, it depends on your activity and how long the pain's been going on. So if you had to sit for a lecture or something for a long time, longer than you normally sit, and your hip was a little bit sore after that, that would be something that you expect. Like, I had to sit for a little bit longer than I'm used to. I usually am able to get up a little bit more during my job or whatever that you're doing during the day. And so that might be a normal, just stretch it out a little bit, not a big deal. But let's say you really like to walk with a friend and you're starting to notice this pain in the front of your hip, and it kind of starts off slow, but it's getting a little bit more painful, getting a little even sharp occasionally. Any issue that's getting worse over time as opposed to better is something that you want to look into. And if you've had even an ache, pain, strain type of feel for more than a couple weeks, it's good to seek care at that time to get it checked up on. The more that lingers, a couple more weeks of walking, you might start to experience opposite knee pain or opposite low back pain or something along those lines. And it can start to trigger a downward spiral. Whereas if you can stop an ache, strain, pain before it gets to be too big of a deal, one, the inflammation won't be as bad. It will typically heal up quite a bit faster. But two, you won't be getting into those secondary compensatory injuries that we tend to see when issues linger on too long. So this is a figure 4 stretch, and you can do these a couple times for 30 seconds. Again, a gentle stretching for short periods of time, and then always consider modifications for your growing baby and changing body. So this lady here is resting up on her hips some, and she's using her hands for support. She's keeping really good posture in her upper back. And then, this lady is also seated, and she's able to do a cross ankle stretch there. And again, you're just adding a little gentle pressure there. Again, it depends on the time of day. Sometimes you might be more or less stiff in the morning or evening, depending on your daily activities as well. So it is cliche, but always listen to your body is one of the biggest things during pregnancy. And just being aware of how things feel and if that feels okay. And generally our bodies are really smart about that, and they're able to protect us from injury. Another one of my favorites is a hip press back. And you can do this with or without gentle rocking for about 90 seconds. And you can do this a couple times throughout the day. I like this one a lot because these two pictures just show that you really don't have to have fancy gear to do some stretches. You don't have to be at a specific place. Like, this could be your kitchen countertop while you're waiting for something on the stove. So yeah, you can use things like the countertop, the wall, the floor, an exercise ball, whatever you have already, whatever feels most comfortable. I really try to limit having people get a ton of gear. Usually with a couple simple things, you're able to do a lot and get a lot of benefit from that. With this exercise, you would gently press back towards your heels, and that stretches out that whole posterior chain really nicely. And then sometimes it just feels good too to add in a little rocking side to side hip movement, and that will just get more into each of those individual hips, which is super nice. Question on breathing mechanics. So how do breathing and the pelvic floor work together? So some notes on breathing mechanics. First of all, we talked a little bit about that nervous system response. So breathing can help to reduce our fight, flight, or freeze response, especially if we're dealing with some anxiety or some stressors, which are bound to pop up, throughout your time being pregnant or postpartum. There's a lot of changes going on and a lot of things to anticipate. But your pelvic floor muscles, they work together with your diaphragm. So diaphragm up here in the upper chest area. So when you inhale, your diaphragm is going to flatten and the pressure in your core or abdomen or your intra-abdominal pressure increases. And then the pelvic floor muscles lengthen out or stretch downwards slightly. And then when you exhale, the opposite happens. So maintaining the correct intra-abdominal pressure allows for proper support of the body during functional movements. And how that looks is I've had different mentors describe it as like a pop can. So when the pressure is maintained, you can see how sturdy that can is. You can't really, pop it or bend it too much. But when you open the can and the pressure is now no longer managed, so if we have something off with the pelvic floor and your breathing and the diaphragm and all of that, it's much easier to crumble in. And unfortunately, that can be your core when you're like leaning over to pick something up. It's not providing you the proper support. And that's why those two things together are really important for you. So one that you can try right now, we're gonna give it a whirl here. The first one is just good old-fashioned diaphragmatic breathing, which most of you have probably heard about. You're gonna place one hand on your belly and then one hand on your chest. And you're going to gently work to focus your breath by drawing air down into your lower abdomen. And a lot of times I'll have people start with about 20 breaths of that. And you can close your eyes too. Really try to focus in on that. So with that fight, flight, or freeze, like we were talking about, a lot of times you see a heavy chest breath. We're doing shorter breaths, maybe more respirations per minute, and they're quicker, and we're kind of using the muscles up through here more often than not. In order to get our nervous system to actually function better and to actually get that diaphragm and pelvic floor to really work well together, so we're not like holding too much tension in the pelvic floor or not able to activate those muscles when needed, doing some of these deeper breaths where you're trying to focus the air to make the lower hand move out. You're trying to get the lower hand to fill the belly with air, and you're slowing down the respirations a little bit. Really great thing to do, even before like maybe some morning prayer or evening before you're trying to fall asleep. But go ahead and try a few of those, and then we'll try one more together too. So once people kind of get that one down, I also like to teach them some rib expansion. Because we just a lot of times don't get a lot of mobility through the thoracic spine. We can picture whether you're leaning over little kiddos and you're playing and doing a lot of household chores, or you're leaning over a computer, our thoracic spine gets incredibly restricted, and this also restricts our breath. And so, yeah, we don't feel like we have as much energy, or I feel like I'm working harder to get more air, and you quite possibly are. So this one places your hands on the outer ribs. So get a good handhold on your lower ribs here. And then you're working to get a really good rib expansion. And almost another cue is breathe into your hands. And so you're trying to get a little bit more of that lateral expansion. And so the more control you get over your breath, the more you can use it to your advantage. The more it's going to help you regulate your nervous system. The more it's going to help you just have your pelvic floor giving you good support during the day for everyday things. If you can do that really consistently, that can also just help you with your delivery and having good tone through those muscles and having control over those when you want to be more active, such as, doing jump rope or some of the things like we've talked about. And then just again on all these exercise positions, just noting your trimester and where you're at and the positions that are safest for you. A go-to safe position is always laying on your left side. So going ahead and doing some breathing there, some visualization, just relaxation is always a good safe bet when you're doing any sort of exercise. Okay, we are going to work on how do you activate your pelvic floor. So because we're sitting, we're going to do this in sitting. However, I actually don't usually first teach it in sitting. I like to teach it either resting on your back or side, and that's just because it's taking gravity out of the equation. So if you want to try any of those positions too, you can. The good thing about the chair or an exercise ball, if you have it, is it actually gives you a little bit of feedback. Like, did I actually lift up my pelvic floor and relax it? You can tend to actually feel that response sitting a little bit better than if you're laying on your back or on your side. But what you're first going to do is you're going to sit up tall. You're going to sit your hips way back in your chair. So first of all, sitting position, we really want to make sure we are actually sitting on our sit bones. If we're slouched forward and there's a gap between our low back and the chair, we're actually sitting on part of our sacrum, and we're getting a lot of lumbar spine and thoracic spine flexion. That puts a lot of pressure on our discs. It makes our joints tight. So first of all, just sitting position in general, we want to be in this position to start with. Now, I'm going to have you try lift up through the pelvic floor as if you're trying to stop the flow of urine. And lift up and relax. Now, during this, you're going to work to maintain your breath. So we do not want to hold your breath while we do that. These are going to be a lot of the cues that I give working with my patients. And don't worry, this is just, if this is first time trying it, it's very hard to do. But these are some of the things that if you just looked up a Google exercise sometimes, it's not going to give you all the information that you need to be successful. So you're working to maintain your breath. You're not holding your breath. Your legs and your glutes are going to want to help you. You're going to feel potentially everything squeeze if those muscles are weak or if you're not familiar with activating them as much. And so we're going to work to relax those as you go. We want to get a more isolated contraction. We want to work to not strain or squeeze your abdomen. A lot of times I see people pulling in their obliques, and people can get a lot of actual trigger points and stuff through here that we work on because they try to pull in things for help. Now, our bodies are a gift and they're incredibly smart. So our bodies know how to pull in compensatory mechanisms, and that is fantastic for the short term. It's the problem when our compensations become a long-term solution to our problem. In that case, a lot of times compensatory issues such as, squeezing the abdomen or tightening the legs, they can actually cause their own pain patterns. And so that's some of the things we address as well. Now, if that was difficult, I want you to think a little bit about just pulling in your belly button slightly. Now, some of the deep core muscles, like the transverse abdominis, for example, they co-contract with the pelvic floor. So because they fire together a lot, that whole deep core is a system really. You can kind of try to activate that lower core by pulling your belly button in a little bit, and then that can get some co-activation of your pelvic floor while you're learning. So one of my favorite exercises for people, I call them elevator lifts because we have those 3 layers of muscles in the pelvic floor, is that we want to lift up through the pelvic floor over a period of 3 seconds. So you're lifting like an elevator up for 3 seconds, hold for 3 seconds, 2, 3, and then you slowly release for 3 seconds as well. Because for a lot of people, they don't actually have control over the muscles. They might even have good strength, but when I test their strength, it's on, off, or on, spasm. And so we actually need to make sure that we can both turn on, maintain a contraction, and relax the muscle. Just like if I was doing a bicep curl, that I could activate the muscle, I could hold it, and I could slowly release. It wouldn't help me if it stayed all contracted, and it wouldn't help me if it was all spasmed or if I could only do that in one direction. And then we want to make sure that you have a fully relaxed muscles at the end. So after that lift, you want to gently bear down a little bit. Super gentle, but we just want to make sure that you're actually actively relaxing the pelvic floor. Or when you're learning, you might kind of maintain that resting tone, and sometimes that can cause a little bit of soreness or pain just because you're not actually fully relaxing the muscles. So the note on that piece as well is if you have any of the diagnoses or you resonate with the symptoms of the really tight pelvic floor or pain in the pelvic floor, Kegels is actually not where to start. So a lot of times we get too much information about, oh, we'll just do some Kegels. But actually for the patient with pain or spasms or a lot of scar tissue, this could actually add to your pain patterns. And so you'd only want to do this if you feel really healthy and you're not experiencing any of those symptoms that we talked about. So with patients that come in with a pain dominant issue, I'm working with them on learning how to release the pelvic floor, how to relax the pelvic floor, how to make sure those muscles are, firing properly first, and then we work on strengthening. Again, if my muscle was all locked up like this and I tried to contract my biceps, that muscle can't fire properly. We need to make sure we actually have good alignment in that muscle first, and then we have the proper tissue length and proper health to do that. Now, if this one was hard for you, don't worry. As you get stronger, the pelvic floor muscle isolation should improve. You'll get better at just getting that just pelvic floor firing, as opposed to, I feel like I have to hold my breath or I'm tightening everything. It will get easier with practice. And so a lot of this just takes some repetition. But again, no pain should ever be present during these exercises.